Assalamu alaikum wa rahmatullahi wa barakatuh. I am going to be your presenter for this evening. My name is Zurina. I want to say shukran to Masood for creating this space for all of us and providing me with some time to use the space so that I can share the topic I'm going to be speaking about tonight. So before I start, we're going to be talking about raising children who have experienced trauma. I'm talking from the perspective of a parent myself, alhamdulillah, of a psychologist, and of a researcher. So what I've tried to do this evening is tailor-make a conversation or sharing of information that I think would be useful to people who are raising children who have experienced trauma. And so I also want to acknowledge that by no means is the information I'm sharing with you inclusive of everything that's out there. And if there are certain areas that you want to know more about, alhamdulillah, we have Google, very helpful. And so it's not expansive, but tailored to suit this evening and the time we have for the session. If there are any questions, I'll leave some time at the end to attend to some of them. Okay. So you can put your questions in the chat in the meanwhile, and then at the end of the session, I will have a look and see what's come up. Sorry, just give me a minute. I work on multiple platforms, so sometimes it takes a minute to remember which ones, how to use the different ones. I've looking at children who've experienced trauma. The aim for this evening, inshallah, the intention is to share information that will be helpful to understanding children's lived experience of trauma from their own perspective. Sometimes that requires us to know about how trauma can potentially impact them and how that can influence their behavior, how they're feeling, what they're thinking, and how they're managing these difficulties. So specifically today, we'll cover what is trauma, the types of trauma you get, how trauma impacts development and behavior, how children respond to trauma and what you're likely to see, and how you can understand what behavior that they're displaying that are evidence of the traumatic experience and their inability sometimes to behave in a way that is more healthy. So understanding that some disruptive or unhealthy behaviors might be an expression of their difficulty in managing the feelings or the experience of having had a traumatic experience. So we look at how they respond, and we're also looking at what we can do from a parenting caregiver perspective to support children to heal from trauma. So I'd also like to say and acknowledge that when I talk about parents here, I'm not exclusively talking about biological parent, but anyone who's in the life of a child that plays a caregiving role. And so to start off with, first we need an understanding of what trauma is. So trauma is often an event that overwhelms the child's ability to cope. A traumatic experience is beyond a person's normal experience, and it involves extremely challenging mental and physical stress for the child. And so if we look at that definition, we can also understand that what might be experienced traumatic for one child might not be experienced as traumatic for another. I think it's also important to bear in mind that, and we'll come to a bit later, but children have like innate inherited capacities or personalities. They have a nurturing environment that allows for certain resiliences to be developed. And so it's a lot of factors that play a role in how children respond to trauma. Also to acknowledge that sometimes you might have 2 or 3 children in the same family who've experienced the same traumatic event, but their response to it and the way they behave and they're able to process and understand it might be different. So it's not helpful to look at a normal response to trauma because it depends on the child's capacity to manage that experience. So the types of trauma, so you get acute trauma, which is single traumatic events, and this might be, sorry, I'm trying to find examples. This might be, and they're all unpleasant, the ones I'm thinking of, but an example of trauma that they could experience might be burglary or robbery, and it might mean that the child may not even have been present in the home at the time when the robbery occurred or the burglary occurred, but the idea that someone, violated their space might be experienced as traumatic, and this could be a once-off event. Then we have chronic trauma, which is multiple traumas, and if we, I think about the current situation right now, there's experiences of people that are exposed to recurrent traumas over periods of time. We're also going to look at complex trauma, which includes abuse and neglect. And this is trauma that often starts at a very young age and might be perpetrated by someone close to the child who's supposed to take care of the child. So I'm going to break this down a little more to give us a more developed understanding of trauma. And I'm going to divide it into simple and complex trauma. So simple trauma is also known as type 1 or acute trauma. This is the one-time short traumatic event that is life-threatening and threatens serious damage or physical injury. So examples of this could be accidents, house fires, natural disasters, and simple trauma may also lead to a diagnosis of post-traumatic stress disorder. We then have complex trauma. It's known as type 2, so developmental, relational, or attachment trauma. And this is when multiple incidents that are multiple incidents over a longer period of time with personal threats, violence, and violation. And examples of this could be child abuse, child neglect, sibling rivalry, verbal abuse, emotional abuse, bullying, and domestic violence. And lastly, what I've included here is repetitive trauma, which may lead to complex traumatic stress disorder, which is CPTSD. And this is a more complex version of PTSD and often involves more symptoms that are harder to treat. What's also important before I proceed to consider is the developmental level of your child and their chronological age. Those aren't always in sync, but it's important to consider that as the parent or caregiver, you're the one that might know the children best. So if you see that the behavior that they're displaying is out of character for that child, then it's something to be mindful of and it's something to take note of. And we'll come later to a stage of how we understand what behavior can be a result of the trauma experience to help us understand how then to support the child. So how does trauma impact development and behavior? It's important to acknowledge, and I think this is especially with complex trauma, that there is a detrimental significant impact on brain development. And there's a lot of studies going into the impact of trauma on brain development, especially early child development. But I've just, for the purposes of this evening, provided a summary of what the impact on brain development could potentially be. And those are varying degrees of cognitive impairment and emotional dysregulation, which can lead to difficulties with attention, focus, learning disabilities, low self-esteem, impaired social skills, and sleep disturbances. And this is something that's really important to bear in mind because often contexts don't allow for an interrogation of early childhood experience that might impact, say, for example, cognitive difficulties. And there's lack of understanding in some respects for how that could potentially intrude with learning and can lead to attention difficulties or learning disabilities. And so it's important that if you are with or you know of or you have a child who has had prolonged experience of complex trauma, especially in their early life, to have an understanding of the potential, and then perhaps maybe do cognitive assessments, but to have an understanding of the potential impact that that might have had on their development and behavior. So not seeing behavior then in terms of isolation to what is happening in the moment, but also how early experience might have resulted in the current behavior, or especially with schools with learning difficulties. So essentially what trauma does is that it derails development. And it does this differently for different children. Again, please hold in mind that it is not a generalized understanding of trauma, but it has to be in relation to whether it is acute trauma or whether it's complex trauma. The recovery time, if I were to say so, are very different depending on the exposure to trauma your child has had, whether it's one incident, whether it's prolonged incident over a period of time. So what it does, again, and this I think is more so in the case with complex trauma, but can definitely also be there with acute trauma, is that it causes the brain to develop in a way that will help the child survive in a dangerous world. So essentially what's happening is that the child's been activated to be constantly alert for danger. And this is the reaction to seemingly normal events that might have reacted differently to the past after a traumatic experience, that now they see as evidence of threat. And when they threat, it's activating the fight, flight, or freeze response. So understanding your child's experience of trauma helps you understand their behavior and what potentially could have been activated in certain situations. So often, depending on what the trauma is, something that can trigger it might be associated with the experience they've had, the traumatic experience they've had, and that in turn can lead to varying responses that essentially are not intentional but are activated because of the survival mechanism. So how it impacts children, again, we're focusing here on chronic and complex trauma. It impacts healthy development. It impacts the child's ability to trust others, to have a sense of personal safety, the ability to manage emotions, and the ability to navigate and adjust to life's changes. There are also physical and emotional responses to stress. It also leads to hyperarousal, where they are hypervigilant or hyper-aware, but it can also be hyperarousal in the sense of being nervous and jumpy and having a quick startled response. There's a general sense of fearfulness and anxiety. There's a repeated retelling or reenactment of traumatic experience, and this happens differently depending on their age group. So for younger children, especially those that are less verbal, it might show itself through play, or so playing with toys or playing with their peers, but you might find that children that have had a traumatic experience might be, for example, more aggressive in play, or might be reenacting whatever had happened to them with the toys, or telling stories in relation to the emotions and the feelings and the experience that they were exposed to. So depending on developmental level, that would help guide you to how best to understand their behavior, but also to understand what they are trying to tell you through play, especially for children who don't have the words or the verbal capacity to share, or the feeling language to share what this experience has done to them, or what this, the length of experience with chronic trauma has done to them. So there's also intrusion of unwanted visual images that of the event that disrupt concentration, and this can all impact on schoolwork. So if your child has had a traumatic experience, it is likely, although not always the case, that might have some impact on their ability to concentrate at school and pay attention. And it's not because they're not able to, but this hyperarousal, this hypervigilance, or these intrusive thoughts might interrupt their ability to be present. So it's important that they get the support they need and the understanding I think they need as they are busy in the process of healing from the trauma. So other ways they can respond to trauma is having spacey or distractible behavior. You might find that they'll sit and just stare, or they'll sit on their phone and not be doing anything. There might be behavior, mood, and personality changes. Again, the best way to judge this is what was your child's behavior? What is normal behavior for your child? What were they like before the trauma happened? And that's the best way to determine the impact of trauma on them now. So if your child was generally introverted, didn't go out with friends, or didn't play with others well, and they've had an experience of trauma, what you'd like to see is a similar kind of behavior, because that would, talk to their resilience in managing that trauma. But if it has been a behavior change, determined by how you know them, what that can show you is that they're struggling to manage the experience, and the behavior change is a way of allowing them to express the sense of dysregulation they have from their normal state. So there's often also regression of behavior of a younger child, and this might mean that a child that was toilet trained might now not be. They might soil the bed, soil their clothes. They might be more clingy, require a lot more attention. This might also be withdrawal and quieting, anger and aggressive behavior, and sexual or risk-taking and acting out behavior for older children or adolescents. There's some more ways of understanding their response to trauma. And so there's loss of interest in previously pleasurable activities. So if your child enjoyed playing soccer or being with his family on weekends, and they're not doing that anymore, it's something to take notice of. There might be sleep disturbances and nightmares, complaints of bodily aches, pains, and illnesses without medical conditions. So sometimes children who don't have access to or aren't able to articulate their feelings might say when they're anxious and they don't want to go to school because they are worried about being away from home and they feel unsafe at school, for example, they might say they have headaches or stomach aches, and then taking them to the doctor, you realize that there aren't any medical causes for that. That might just be an expression of how they're communicating their lack of regulation again, but also their difficulty in expressing their feelings with regards to what happened to them. There might be self-blame, guilt, or shame. So again, this is related to what the event was and what their traumatic experience or experiences was. They're frightened by the intensity of their own feelings. There might be a vulnerability to depression, and there also might be self-harm and suicidal thoughts. So these are the spectrum of potential difficulties that children or adolescents will show when experiencing trauma, and it's by no means a kind of guideline to what your children. These are all the things your children could manifest in relation to the trauma. But if these are things that you think are evidenced by their behavior and in how you're seeing them respond post-trauma, then these are all things that you need to consider in terms of the level of support that needs to be activated to guide them through. So what you might see, again, this covers a lot of what we've gone through before, but just more overt behavior is problems concentrating, learning, or taking in new information, difficulty sleeping or toileting accidents. There might be emotional instability, so labile mood, so mood shifts. They might be moody, angry, sad, and aggressive. There are age-appropriate behaviors and children acting or playing out the traumatic event. So that was an overview of trauma and the potential ways that children can that trauma manifests in behavior, and also the impact it has on their emotional well-being. Also looking at how trauma can impact brain development, so to consider all of the different factors when thinking about the support that needs to be activated and the help and the guidance and the time a child needs to respond to process the trauma and move forward and heal from it. I think it's important to acknowledge that people heal at different paces. So from my perspective as a therapist, there is no timeline for healing, essentially, with trauma, but that also depends on what the traumatic experience is and whether it is chronic trauma or not. So there's a almost not normal, but if it is that something happened at school, for example, and then the child was bullied, and 4 years later the child's still anxious or reluctant to go to school. So that would be concerning. Or sorry, 4 years is a bit long. But maybe say a year or two later, after steps have been in place, they may be in a different school if that was, or intervention was held with the bully and that was sorted out. It might mean that the child's not really processed that experience. And so that means you'd have to put other things in place that will help them feel more comfortable. And so the things we're going to look at now are ways of dealing and healing trauma that can essentially be part of their life. So these, when we're looking at resilience and attachment and the role they play in helping children resolve and heal, and the role parents play or caregivers play in helping them resolve and heal, it is not a once-off treatment plan. So, for example, the child's had a traumatic experience now, and so we're going to put these measures in place over the next 2 or 3 months to help them heal from trauma. Essentially, what I'm suggesting is part and parcel of a parenting approach that will help consistently provide the child with an experience of secure attachment and resilience that they essentially need for the rest of their life. So it's not a treatment plan here specifically for this trauma, but what the research says in relation to what are the best processes or support structures that a child needs to be put in place to help them survive and heal their experience. I think it's also important for me, why this focuses on raising children and coming from a parenting perspective. As a therapist, essentially, when I see children, it's 1 hour once a week. And the literature said this, the research says this, that the best form of support and resource that the child has are their parents and caregivers. So essentially, you play a lot more important role in your child's recovery and healing from trauma than a therapist might. So sometimes parents might struggle to understand how best to manage behaviors post-trauma, and therapeutic support or seeing a psychologist for that can be very helpful. But essentially what matters most is that if your child is seeing a psychologist also post-trauma, that you're also having mechanisms or support structures or things you are doing at home to help support the process, because ultimately the most important relationships, the most safe and the secure relationship is with you. So what we want to do with helping them heal is foster and strengthen that relationship so that the feeling of not being safe in the world, that the trauma is activated for them, gets buffered by the feeling of safety and security they feel in their relationship with you. So building resilience, this is just one of the ways that we can help children deal with trauma, but it also impacts how children may have responded to trauma. So I said at the beginning that no child responds to trauma in the same way. And so one of the factors that play a role in how children respond to trauma and how quickly they're able to heal from trauma is their resilience. So resilience is our ability to thrive in the face of challenges. And the more resilient we are, the better we are able to adapt to adverse life situations. And so that also plays a role in determining how much time a child might need to recover, or what internal resources they have that can help them work through this experience. And so in talking about resilience, again, it is not to say that two children raised in the same family will have the same capacity for resilience. So again, when we go back to two children having the same traumatic experience, they might have different capacities for resilience that allows them to navigate their way through trauma better. So you can't say, oh, but your brother they had the exact same experience, but he's better now. Why are you still acting out? It's important to understand that the experience and the process for each child is very, very individual and very very much determined by who they are and how they understand the world and what they have available to access. So how do we increase children's resilience to trauma? Essentially, the most important role that I just spoke to now is above therapy is the relationship with at least one competent, caring adult. So imagine a traumatic experience is out of the norm for them. It's unexpected. What it tells them is that the world is unpredictable and the world is unsafe. And so from that traumatic experience, they then have now had such a different from the norm and their understanding of the world experience that it challenges their sense of safety generally. So it might mean that traumatic experience happened in one setting, and now what you notice is that they're anxious or unhappy or acting out in different settings. Their worldview has been shifted by the trauma. The world as they knew it, as they come to understand it and expect things from it, has completely changed. And with that has come the insecurity of not knowing when something can happen again. I wasn't expecting that. That is a normal, but then it happens. So how do I know something like that won't happen again? How do I know something different won't happen again? And what we need to do then to help children find and access the resilience is give them a sense of safety in at least one sphere of their life. So feeling connected, a sense of connection to others, a sense of connection with not only a parent or caregiver, but potentially a positive role model or mentor. Also having their talents and abilities nurtured and appreciated, having some control of their own life and having a sense of belonging. Those are each different areas that can help children access resilience and foster resilience so that they're better able to adapt and heal from what they've experienced. So with this building resilience process, the starting point for children in dealing with trauma might be different. There might have been earlier experiences that they've healed and recovered from, and then later life experiences that also they experience as traumatic. It might mean that the earlier experiences were unprocessed and unresolved, so that this current experience carries the weight of those previous experiences with it. And you'll see that when you see that the behavior and the reaction to what's happened is out of proportion to the event. And it's difficult to do this without an example, but it's also, there's so many examples I can draw on that might help you understand this a little better. I think if let's just stick, for example, with bullying at like creche, and they've had an experience of bullying at creche, and that was really traumatic for them. They were really scared to go back to creche, but over time they found that, the intervention was put in place, they felt safer, it was better. There's a part of them that's, if it's not completely processed, is still aware that my world isn't always safe. There is also potentially danger, because for a young child, it's a very simplistic understanding of what could happen to them. So it's this, might essentially just be experienced as, oh no, there's danger in this setting, and I'm safe at home. Later on in high school, they might have a similar experience, and because of the earlier experience, they might find it harder to recover or heal from it than a child who's had their first experience of bullying in high school. I'm hoping that makes sense. So what's important, I think, here is that we need to validate feelings and not judge feelings. So children are unlikely to share feelings with you if they're going to feel judged for their feelings. They don't choose their feeling. It's a feeling that's elicited by whatever they experience or they're thinking about. And so if we want to allow them experience of processing it, it's important that we validate, so that, because they might feel unsure, they might feel guilty, they might feel shame. I wasn't bullied in grade 7, but my friend was. I'm so glad I wasn't. Again, that's not trauma specifically, but that's just about the things children can attach to experiences that might be shameful for them in relation to trauma. So validating feelings are very important. I often say to parents that they refer to it negative feelings, but I like to call them uncomfortable feelings. So feelings of pain and rage aren't necessarily negative from my perspective, and people hold different views, but they are uncomfortable feelings to watch or see or experience. And so children are more likely to not want to share these negative experiences because they're wondering, or wanting to be okay for you, or they're not allowing themselves a space to process it and think about it as just their way and their feeling attached to this event. So if it is rage, there are healthy ways of, managing rage, and ways that are unhealthy. And I'm not by in any means saying validate the behavior, validate the feeling, and find healthy ways that allow them to express their feelings through behavior if they have been unhealthy ways. It's important to acknowledge, reassure, and encourage them to speak. Again, this might have to happen on their terms, depending on your relationship with your child, how comfortable they are speaking with you. It's important to provide a space where they know they can come to you. So I've noticed from my experience with teenagers that often sitting one-on-one might not encourage conversation, and so find ways and spaces, even in doing things, to allow them a space to talk about what they experience. It might even mean that you say to them, I understand that this is really terrible and really hard for you to go through. And if ever you're ready, whenever you're ready to talk about it, let me know and I'll be there. So as long as they know they have a place to go to, we don't necessarily need to interrogate their feelings, because that might feel unsafe for them in the moment. That might also feel like they're out of control in, navigating navigating their process of it by their own terms, because often these traumatic events was not on their terms, not for children, not that things often are for children, but depending on the circumstances, it's a way of giving them control again and giving them autonomy and saying, here's the space that's available to you whenever you want to talk, or however you choose to express it. If you want us to go for a walk, because that will help you because you're struggling with these feelings that you're sitting with, and that's their way of processing it. What's really important, especially for older children, but for younger children also, is to maintain a regular routine. So often when children, or not often, sometimes when children experience trauma, what parents might do is make allowances for the child because they feel so sorry for them and what they've gone through. What's most helpful for that child actually is that you keep the same routine and the same ritual. What you're providing them with is the consistency that although this has happened to you and it was unexpected and you were unprepared for it, and it was really difficult and traumatic, here's a space of safety. Even though some things have changed, and a lot of things often change with children after trauma, here's one thing that has stayed the same. So when we're providing children with an experience of consistency, they can recognize that even though this has happened to me, or even though this has happened to us, there are some things in my life and spaces in my life that I can trust to be the same. And so this offer of safety is something that's essential to children who've experienced trauma. And so actually you're not helping them, even though they might not express it that way, by changing routines to suit them because you are accommodating their needs at the moment. Again, I say that holding in mind that there are certain things that might need to be shifted. These aren't, dead set fast rules. They're just guidances. And essentially you have to navigate with your child which ones are more flexible, which boundaries around routines and rituals are more flexible than others. But essentially what I'm saying is that routines and rituals are boundaried and then safe. So remind them the steps that you've taken to ensure that the trauma doesn't happen, if that is within your capacity. Help them set goals, and that goals might be for a child that has had a traumatic experience, doesn't feel comfortable playing soccer on the weekend, that they can start by going to the park with one friend as opposed to going back to their team of 10 players. So all of these kind of ways of navigating, it's individualized to your child. So keep all arrangements you've made with them. They need to know that there's one person that they can trust. and that, that will hold their word to them. Again, that is representative of safety. So remember, we were talking about how unsafe this experience was for them. What we're trying to do is give them spaces that are almost consistently safe. And I say consistently because we don't always have the capacity to be as available to our children always, but as long as they know that there's a safe space for them to come to, and that they can access, even though the world might be unpredictable, that can do a lot in developing and building resilience. So even though those bad things happen to me, I know I have people, I have support that I can go to that will never change. They almost need a guarantee, which is really hard to do in life, a guarantee of something being constant. And so consistency doesn't necessarily mean your constant presence. Consistency means your availability to be present, or your availability to be open and allow them to use you as a source of containment or as a source of safety. So there's also helping children stay away from stresses. Again, that's if it's in your capacity, and talking them through the steps they can take if the situation occurs again. Bullying is a less extreme compared to other experiences of trauma a child might have. But if we stay with the bullying example, what we can do is we can have an intervention with the school, talk to the parents, and try and find a way to have your child feel safe at the school. We can also look at developing the capacity to manage the situation differently in the future, should that happen, and that can allow them to feel more empowered and in control of things that might happen to them in relation to that. So the two areas that I'm focusing on is essentially ways of building capacity for your child to experience safety within themselves, which is what they'll get with the resilience, but also safety within their relationship with you, the caregiver. So attachment has, in research, shown itself to be essential in the development of child, especially in the early years, both in the neurological development, in cognitive development, behavioral and emotional development. Attachment relationship has shown itself to be critical. And so this is a deep emotional bond that forms between the child and the caregiver. It's a mostly consistent caretaking environment in which the physical needs and emotional needs for safety, soothing, and emotional connection are met. When these are in place, we refer to this as a secure attachment. So if you've mostly been available to your child and mostly been able to meet their needs, this should foster a secure attachment relationship, where is, in essence, what you represent to them is the secure base. So the secure base is really important to children that have experienced trauma. And I've repeated this a few times, but essentially what we're working with is a child who's now learned that the world isn't predictable, the world isn't safe, and the world is potentially a very frightening place for them. And so what they need is to know that there's a space available that can offer them safety and security should they encounter this. So from the secure base, the child can begin exploring the world, knowing they are safe. They have a safe haven to return to in times of distress. So essentially, ideally, we want this secure attachment relationship and the safe base to be established very early on. But this can also be put in place later in life. And if it's available to the child consistently, where they feel connected, where they feel heard, where they feel valued, where they feel soothed, essentially that can become a secure base to them, so that they know that even if I go out into the world and things happen to me, I know there's a place I can go to when I'm distressed that can make me feel better. And so with younger children, you see this more obviously, I think, than with older children, where they'd be clingy on their parents after trauma. They'd be, wanting, if they were if they were toilet trained, they'd maybe regress and want to start wearing a nappy again, or they might want to be fed from a bottle again, for example, or have a toy that they used to have when they were littler. So it's more obvious with younger children than with older. With older children, they might be acting out behavior, but essentially it's really important to consider if that behavior is normal for them, if it's developmentally appropriate, not that all behavior is, if it's acting out, and then find a way to navigate it so that they can feel safe and secure. And with younger children and older children, it's routines and rules, but older children often need those rules reinforced so that they can understand that they have a place to go back to that will pull them back, even though in the moment that's not what they're wanting. So essentially, a secure attachment has been linked to a child's ability to successfully recover and prove resilience in the presence of traumatic experiences or events. So attachment essentially is your child asking you, are you there for me? And again, think developmentally, what does my 14-year-old need for me to be, to experience me as being available and there for them? And what does my 3-year-old need for me to be? And those are very different things. It also depends on your relationship with your child. So are you there for me is essentially asking you, are you accessible? Can I reach you? Are you there? So remember, sometimes for some children, they might not take you on that offer in the moment. And you can say, well, I've asked them so many times that I'm here and I want to talk to them about what's happened, and they don't want to talk to me. I think what's important to acknowledge is that you have made the space available. You've guaranteed that it would be available should they need it. And so being accessible is just that. Knowing that should they need you, you are going to be there. You're going to be available for them. Are you responsive? Can I rely on you to respond to me? Does my distress matter to you? Will you comfort me and will you care to me? And it's often not as clearly shared at that, but it's often shared through behavior. It might be the 14-year-old that's acting out, that wants you to understand that this behavior is a manifestation of the internal struggle that they don't have language for, or they can't share with you verbally. And what they're asking of you is to look at the behavior not in isolation, but whether you as their parent can understand that I'm struggling, this is my way of showing it. And so how you respond to me is really important now, because I need to know that you understand me. The last part is engaged. Will you give me your attention? Will you be present? Will you stay close? So, life being as busy as it is, there's not often time. Time's often something that a lot of parents I work with struggle to have available. And so what I say is that it's quality over quantity. You don't necessarily need 5 hours one-on-one time with your child. What you can do is make sure that you have very focused, very present. No one's on their phones, no one's distracted by the TV, very focused and very present time with your child where they feel fully heard, fully engaged with, and that you're not distracted by other things. And what that means for different families is different things, but making that time available is important. Or saying, if you need time, let's after whatever, after we do the dishes in the evening, let's have a cup of tea and sit and have a chat. When you have bath time with your younger children, you can have a conversation with them where you're just attentive and present to what's going on with them in that moment. And even if they don't use the space, what they will see is that she is here for me. She is fully present. And so that I have that to go to if I should need it. And so don't get discouraged if you make times available and they don't use it or they change the terms. That's okay, as long as they know that it's there if they need it and that it's their choice to use it or not. Although there might be times, especially with children that are struggling, where they have less of a choice because their behaviors just really had a dysfunctional impact on your family life or your life or their school life. Okay, so attachment and building this connection essentially is about talking about feelings, helping children identify feelings, but also modeling talking about feelings. So what is sometimes useful if your child doesn't have the words or can't articulate their feelings about an experience, you can share yours with them. You could say, for example, that was a really hard or difficult situation that you had to go through. I think if it had been me, I would have been feeling this, that, and the other. And so what you're doing is you're giving them the language, you're giving them the feeling words to to help them think about and process and understand and verbalize their feelings. But it might not even mean you get it right, and you don't have to get it right. They could say, well, no, that isn't what I'm feeling. I wasn't feeling overwhelmed. I was actually feeling really angry. Again, what you've done there is you've encouraged a conversation about feelings. So getting it right isn't essential for this process. All you want to do is share with them a way of describing their experience and their feelings that will make them more open to sharing it with you. And so feeling language, again, is different developmentally. And so find a way of using what you already have established in your family in ways of communicating or ways of expressing yourselves that makes the child feel safe enough to speak about it, but also it relies on your family dynamics that's already pre-existing before the traumatic experience, that's familiar to them, and so then can offer kind of a soothing, constant, safe interactional space. If you can talk about feelings, if you can talk about feelings, you don't have to act out on them. So essentially, that's what we're encouraging. So we're giving them a way of processing what they've experienced that is healthier, and that discourages behavior that are an expression of feelings that might not be healthy for them. Okay. So one of the ways we do this, one of the ways we establish connection, and something that I often speak about in terms of engaging from a space where you're trying to look at things from your child's perspective, is that it's one thing to understand what trauma is and how it might manifest and what you could see so that you can have an understanding of their behavior. But you also need to have an understanding of what the emotional response might be and what they'll need from you in that moment so that you can, better manage what they are expressing and the behavior they're showing, even if it seems contradictory to their feeling state. And so for this, it's important to access empathy and your capacity for empathy, because what this refers to is staying with your child in their emotional state and experiencing it with them. So as an adult, you might have different processes or resources, external and internal, available to you that allows you to experience trauma in a certain way. Your child doesn't necessarily have the access to the same. So their understanding of experience of trauma and how to work through it might not be yours. So you can't say, well, you need to do this, that, and the other, because that might not be their process. What you can do is talk about your own process that gives them kind of a guidance on what might happen if trauma happens, and what might happen to your feeling state if you have these experiences. So separating your own experience from your child's is essential to this process. This is what helps them feel heard. This is what helps them feel validated and understood and acknowledged. And so through empathy, what you're essentially saying is that you're trying to understand their feelings and you're supporting and comforting them over the stress they're feeling. You are not judging their feelings. You're not judging their process. You are saying, I see what this is like for you. And not necessarily in words, but I see what this is like for you. And this is really difficult. And when I had a difficult experience, I also felt overwhelmed. And that's okay. So in conveying empathy for their current state, you are joining them in their distress. And so often parents with children who have experienced trauma themselves, if they weren't exposed to the same traumatic event, might be traumatized or struggling with their own parental responsibility and how to manage their own feelings about what happened to a child. And sometimes those can overlap. And so there's no judgment when they do or don't. I think it's might be part of the process also, but it's important that you are aware of what is your feelings and what's your child's, so that when you sit with them and when you're empathic to them, it's empathy based on their experience and not yours. So again, it's important, I think, with modeling that we were speaking about earlier, that you as a parent who are having to witness a child who is struggling are able to separate what is your feelings and what is theirs, so that you can be available to them for what they need from you, and you can seek support for what you need for your own for your own feelings about the experience. So empathy, again, is feeling with someone. It's the ability to take someone else's perspective, to stay out of judgment and recognize emotions in other people. It's also the ability to communicate that emotion. So in order to feel empathy, you must connect with something inside of you that allows you to feel and recognize the same emotion. And so you often, even if you haven't had the same traumatic experience as someone else, you may have had a different experience in your life of sorrow, of feeling overwhelmed, of feeling enraged, or of feeling completely helpless, that can help you better understand what your child might be experiencing. And so what you need to do is access your memory of what that was like for you and imagine that that's your child experience right now so that you can be empathic. And it's not about giving a situation a silver lining. It's about your child having an experience of feeling understood and recognized, and having their feelings be okay. And having you be okay with the feelings that they are feeling. So the situation in itself is not necessarily made better with the responses, but what this helps is with the connection. I also think, getting it wrong is not the worst thing. Getting it wrong is a way of developing understanding. So just be mindful that you don't always have to guess the right feelings in order to understand what they're going through. And I've said this earlier also, the wrong feelings is also guidance because it allows communication. What it's also telling them is, I'm trying to understand. And so I'm not getting it right, but it's really important to me that I understand what you're going through. I think it's this. And so even if it's not, what they see is your investment in trying to really understand what things are like for them. Why is it important? It helps the parent understand, and it helps the child feel understood. It shows that you are there for the child. It can prevent further difficulties because it makes the child feel understood and more secure. The child knows they have someone to go to, who, though might not always get it right, is willing to be present and listen and sit with them as they figure it out for themselves. It helps the child identify emotions and begins to teach them how to manage their feelings. So once they recognize the feeling, what you do, again, depending on the developmental levels of your child, is you find healthy ways of expressing that feeling. And sometimes the very process of talking about feelings or knowing that they have a space available is cathartic enough. I also think it's important to acknowledge that developmentally, some children are more likely to access you or someone else, but as long as it's an adult that they feel secure with and safe with, it might be a grandmother, it might be an uncle, it might be a neighbor that they've known all their life that they feel safe with, as long as they have someone with who they can share the experience with, that's the important part, because that allows them to process the experience so it doesn't show up in behavior in ways that's just more unhelpful for them. Okay. Let's go back. So healing through, sorry, I'm just checking. Healing through understanding, and this is looking at reflective parenting, which takes empathy, it takes it to a little bit more depth. So it's important to bear in mind throughout this process that most of the behaviors develop as an adaptation to trauma. Some of the behaviors might not be deliberate, it might not be intentional. It's their way of adapting to a traumatic experience. So it's important to remember the impact of trauma on the child's level of arousal. So remember we spoke about it right at the beginning with trauma, there's a high level of arousal, there's a lookout for danger, there's a hypervigilance, and they're quick to react to threat. They might even perceive things that are safe as threatening based on the experience of trauma that has kind of shifted the understanding or comfort level in the world. The aim then with parenting is to lower the arousal level. So make sure these things that would activate their hypervigilance and make them feel unsafe, are things that you can minimize if it's possible. Think about what might contribute to the high arousal levels. So it might mean that very loud noises is something that activates your child's distress and then makes them hyperactivated. And then, so for example, avoiding certain situations or ensuring that car doors aren't slammed, for example, that can help minimize it. So it's not always within your control, and that's acknowledgeable. But when it is within your control, depending on what your child's experience, if you see, oh, that's how they react, and this just happened before that, maybe prevent it in the future if it's possible. Always trying to grow resilience. And is there a way that the child's being disciplined to help with this? We'll come to discipline a little later. Maintaining a connection with the caregiver is essential. It makes the child feel safe, and the basis for changing behavior is the relationship. So if you want them to heal and recover, the healing and recovery happens in that relationship with an adult that they feel safe with. So in terms of managing behavior, the top aim always is to avoid the child becoming dysregulated or misbehaving. I shouldn't actually have that there. Dysregulated in the first place. So understandably, this isn't always possible. So what do we do then if it's not possible for them to avoid the factors that dysregulate them? We then create an environment with low arousal, so safe, consistent, and minimal threat. And so even though the world outside of your home might not be within your control to minimize the arousal levels, what you do, even if they have a room in your home or a space in your home or someone else's home where the arousal levels will be lower, where they feel safe, consistent, and they don't feel threatened, and they don't feel this need to be hypervigilant all the time. We've spoken to this again, but just reinforcing how important it is to have rituals, routine, and structure. This is children of all ages, whatever that structure might be. So it's not necessarily a change in structure, but more a maintenance of the structure that you had in place for the child prior to the trauma, so that they have a sense of this one thing in the world that stays the same and is consistent. So rituals also have dual roles. They have more than one role. They help us feel connected in families. Children feel like they belong and they have a role to play. So if they had chores to do, what you want to do, if it's possible with time, is to make sure that they're doing the same chores they did before the traumatic event, so that they don't feel that something's wrong with them. How children interpret things can be quite tricky sometimes. So it's really important to have a conversation with them, because they might feel, oh, I used to do this in the house, but now I'm not asked that anymore. Maybe what happened to me means there's something wrong with me. So I have a different role to play in my family. So it's really important that we have conversations so that they don't misunderstood when allowances are made, or that they understand why allowances are not made. So routines, resistance reduce when children know what to expect. What routines allow for is a predictability. And so remember, what we're counteracting is an unpredictable experience. So these help children feel safe and cared for. That has come up so much. That is the key theme, I think, in helping children process and heal from trauma. Structure is important. So if there were policies, rules, turns, reassure your child that you are in control, and we ensure fairness. So whatever structures are put in place, whatever rules, boundaries, and disciplines you had in place before, they need to stay as firm as possible, because they give your child a sense of familiarity. Managing behavior, again, this is all age appropriate. It's important that you're very clear in your communication to your child. So try and not have subtext. I walked out and I thought I walked out of the kitchen, and he knew when I walk out, he's supposed to go in to do the dishes, and then he doesn't. Maybe just communicate with him. So remember, they're activating at a different level now after the traumatic experience. And so they might not be as attentive or attuned at times to what's going on around them. So use do instead of don't. Be a role model and make eye contact. Listen and communicate what you have understood to the child. praise them, offer rewards. Again, this is depending on the age. So say your child that has had a difficult experience or a traumatic experience at a creche is now going 2 days a week, and then next week's going 3 days a week. If you have a sticker chart or a bean chart, just a way of monitoring their performance, because they might need more, they might respond better to those. In terms of managing behavior, also commands are often used as a last resort. Commands aren't shouting, commands are just more firm. I've asked you for 2 nights to do the dishes as soon as I leave the kitchen, and you haven't. Can you please make sure it's done? So that's an example of a command. So timeout, again, timeout is not a punishment. It's a way of allowing you and your child some space. And it also helps with self-regulation. If you take your child out of a space that's potentially hyperactivating in terms of their arousal level, sometimes just physically moving them from out of the space is helpful to cool them down or cool them off. And this might also mean that they then are able to get to a place where they can have a more healthy response to the situation than were they to remain in it and then not manage it well. Also, adjusting freedom, give your child as much freedom as they can handle. And so this, again, all needs to be age appropriate. So you're allowed to play in the park with your friends for 15 minutes or 30 minutes after school. And that is determined by their age and their sense of safety. So if the park, for example, is opposite your home and you can see it through your window, for a child that's gone through trauma, is ready to make that step, that can be quite a significant one that you want to encourage. So sometimes what happens after trauma is that parents might feel like they coddle children more because they scared themselves. And again, this is not a judgment. I think that's a normal part of the process. What's important, though, for your child's own development is that slowly that they feel safer and they allow themselves to be in situations that are safe. They're not unsafe, but allow them a bit more freedom, and that you ensure that they have that experience of it so that they don't stay kind of like rooted in this place where the world is essentially a fearful place that they cannot venture into. Because as they get older, they're going to have to navigate it in different ways. And so we need to allow them a healthy way of experiencing it with a sense of autonomy and freedom that's appropriate for them. So then we're moving on to managing emotions. And so this talks to emotional regulation. So again, there's feeling states and then there's behavior states. But once we can understand and name feelings, it's a better place to start from. So naming feelings for your children can be really helpful depending on their age, because as arousal increases, cognitive ability decreases. When your child is hypervigilant or hyper aroused, they don't make their thought processes are interrupted by that because survival mode almost kicks in. So the hyper-aroused child may be defiant, resistant, upset, or aggressive. And anyone in a hyper-aroused state cannot be reasoned with. You might have noticed this with your own or with other people who have toddlers that have what's referred to as temper tantrums, that often it's really hard to shift them out of the state because that's often a state of hyper-arousal. So the first job then is to reduce the arousal level. In some cases, when it's appropriate, you can physically move them out of the space they're in and move them to a space where they might feel safer. Sometimes children also respond well to physical containment, where you hold them. But then again, it depends on what your child needs at that time and where you are and what's available to you. If parents are in the state of arousal, they need to step away and find their calm before they go back. So knowing what you're learning about trauma and how children can experience trauma does not necessarily mean that you will always have the best response available to you in any given moment. Parents are also activated. Children act out in varying ways that can be very challenging to work with. And parents are human too, right? And so we also can't always give the perfect response or be completely empathic. When you find your own internal state of arousal means that you're shifting to a place that's going to be very unhealthy for you and your child, the time out that we spoke about earlier is as important for you as it is for them. If you can't be calm and offer them your calm when they're struggling, then it's better actually that you step away until you can calm yourself down and then revisit the conversation. Because it's likely that if you are overactivated and they're overactivated, that the way that it's going to be dealt with is not going to be the best way for you or them or your relationship. So when we talk about managing this emotional regulation, again, it requires conversations. It requires you to have the capacity to be empathic, so you're not so activated that you can't access your own empathy. So it's about not being able to engage in challenging conversations when you're feeling like that, because like I said, you're also activated. And so the outcomes are better if parents do not get activated by behavior. But as I said, we're human too, and so it's unlikely that we're not activated at all. So essentially, when you do feel yourself activated, that you step away, is what you're also communicating to your child is that I can see that I'm not in a space to deal with this right now, and it's okay to walk away from it and then come back. That's healthy role modeling. Okay, we're almost done. This is my final slide. And so often in my talks, I like to include parental self-care. So we cannot provide our children the space and the availability and the care that they need after trauma if we aren't feeling that we have that available. So what we need to do is take care of ourselves so that we can be more available. It might also be that you and your child went through the same traumatic experience, and so it's difficult to separate what's yours and what's theirs, and understandably so. The example I shared earlier was for parents who hadn't been in the same experience, so that you get the support you need so that you are more available to them. If you can't, so essentially that's an important part of this secure attachment relationship, is that you're able to provide them with the support that you have available to them, and that you don't feel overextended just in managing your own emotional state. So you can't lend them your calm if you have no calm to draw on. So it's important that you look after yourself, you access a support system, be as healthy and happy as possible, physically and mentally, try and lead a balanced life, build on your own resilience. And so the same things that children need to help boost their resilience are things we as adults need. Maintain a connection to others, keep stresses small. That's not always within your control, but consider how you manage stress and find ways of managing stress that are helpful for you so that you are able to be available to your children, and also seek professional help if needed. So that reaches the end of this talk on raising children who've had experiences of trauma. It was my intention to share some understanding of what trauma might be like for children, and the difficulties, and having you understand what some of the behavior and the difficulties you're dealing with, what it might mean and how to work your way through it. So I hope, inshallah, that has proven to be so this evening. I have about 15 minutes for questions, so I'm going to go into the chat now. But if there's anything that you'd like me to revisit, if we have the time available, inshallah, I'll go to it. I think just before I even go to the chat, I just want to reiterate that the parents are often doing the best they can. And sometimes when there is a disconnect, it's likely to be lack of understanding. What this talk was for was to provide you with an understanding that your child might not even have for themselves, because they might not have an understanding of what trauma does or what it's done to them. And so I'm hoping, inshallah, that you are able to see more from a child's perspective what it can mean, and that the behavior can't be seen in isolation to the event. But let me go on to questions. So there are questions in the Q&A. Shukran for the comments in the chat. So I'm just going to go to the questions in the Q&A, and the first one is, Assalamu alaikum. If a child is rebellious or is difficult to deal with, does it mean that they experience trauma? So there are a lot of things, and these chats are often difficult for me to answer because I don't know the context, but it potentially is a sign of trauma. It can also be a sign of a child that's dysregulated, insecure. There might be other difficulties that they're dealing with, and that's just how it's showing up. So I think it's important to look into it, like just systematically checking every area to see what can contribute to this rebelliousness or difficulties. Also, is there some level of it being age appropriate? Because children at certain developmental levels test boundaries. And so what you need to do is reactivate boundaries to make sure that they're not acting out too much. But we can't discount that it could potentially be evidence of trauma. The next question is, been divorced for 9 years, have a 14-year-old and 9-year-old boys. Father plays the boys against each other and promises things which never materializes. So how do I help them with you? That's a really difficult one, especially with co-parenting, if there are different rules and rituals and in the different households. I think what's important is that there needs to be a consistent message. This also needs to be a conversation with the father about what this means, but if that's not possible, then it's important that the primary caregiver, I don't know if that is you or the father, the primary caregiver shares the message that this is unhelpful, because what it does, it doesn't damage it, it can harm their relationship rather than strengthen and support the relationship with each other. And so it's like life, and when they go into school, they're exposed to different rules and different ways of doing things. We just need to ensure, inshallah, that the consistency and foundation and the message that they get is beyond everything else that's happening in your life. This is the important rules. These are the things that are unbreakable and unbendable. And how you navigate that when there are separate rules, it's not easy. I understand that. I'm going to the next one. I don't know if I've done that any justice, but how do we know if a child's response is from trauma that child has been through, or mental disability such as autism or ADHD? So it's difficult to answer that, because that's a very complicated question. Essentially, what you want to do is you want to get professional support. You want to have your child assessed for ADHD and autism so that you know whether you need to exclude it or not. If they had those checkups and they have and they're not diagnosed with autism or ADHD, then your next you go through a medical checkup, and then you go to maybe a psychologist for professional help, because what you do is you're going through a process of elimination, which is not to say that the child who hasn't had a traumatic experience can't also have autism or ADHD or other mental health difficulty. But it's very important for you to understand what the causes are so that you can have the best treatment plan available to your child. Because if a child that's showing a response to trauma, and you think it's just behavioral, but actually there's also a ADHD, for example, component to it that needs treatment on medication, you will see that the response or the behavior change you're looking for won't show up because it hasn't been thoroughly investigated. So that would be my go-to. Okay, I see a hand, Khadija. I am just going to see what other questions there are, and then if we have time, we're going to work through this. So tips on healing our childhood wounds. So one of the things I didn't include tonight, because I feel like that's a topic on its own, is generational trauma and how that gets transmitted from generation to generation. It gets transmitted in how we parent, how we talk about feelings or manage feelings. It's really important that parents who have experienced trauma have their own space to process that and make sense of that. And so often with generational trauma, it might be a process that requires some therapeutic or professional support, depending on how much trauma needs to be unpacked or how much of it is showing up in your life. And so the best thing you can do for yourself and your children is get the support you need to process this, so that you can offer them spaces of calm or healing or healedness that they can use you for. So please advise and guide adult children that has experienced trauma and require therapy. So there's no cutoff date to experiences of trauma. What we do suggest, though, is that we not wait too long. So if your child is experiencing trauma now, what you're essentially doing with the resilience and the attachment and the emotional regulation, what you're essentially doing is you're allowing them a space to process it, because unprocessed trauma doesn't go away. And it can manifest in very different ways in relationships, in behavior. And so it's important that we tend to the parts of ourselves that are wounded, because it is likely that they're going to show up in different ways that aren't healthy for us in terms of how we relate to others, the choices we make, or how we feel about ourselves. I'm going to go to one more question, and then I'm going to go to Khadija, and then we'll have to finish off for this evening. What if the parent is a child who had trauma, or talking to children with double dose trauma, kind of? So my understanding of that question is, what if the parent had their own experience of trauma, which is being activated in their child's experience of trauma? That's a lot for parents to manage with. And I know I've been saying all evening that there needs to be a primary caregiver who's a secure base for your child. But if you feel that you don't have the capacity to be available to your child because you're not only sitting with your own trauma, but now sitting with more trauma on top of that, that you need to get a space for healing yourself first. So that you are going to be available to them, and then maybe determine who else can be available to them. There's a grandmother or family member who they have a good relationship with. But also, if you are the primary parent, I think you need to be very mindful of what you have capacity for and not to take too much on, and also not to be too hard on yourself what you have available for them, because you're also working through your own processes. So do what you can with what you have, and don't be too hard on yourself in that the way you're working through this with your child looks a bit different to a parent with no trauma. I'm just going to go to the hand. I won't be able to take any more questions. I'm going to go to the hand in the Khadija. Okay, I don't think there's an option other than through the Q&A. Sorry, I'm going to go to the last question now, and then we're going to finish off after that. Shukran to all of you for being present and sharing your questions. What is the proper age to tell kids the reason parents divorced? The father was on drugs and abusive. That's a difficult one, because I don't know if there's a proper age. I think that's very difficult. Because I don't know the context. I don't know if they have a relationship with their father now, what the nature of the relationship is, whether it would be doing them harm to be that honest, whether they are older and it means you have to lie to them, and so you feel like you're uncomfortable lying. So I think there's a lot of factors to consider to determine how much we share with children and how much is necessary. Also, we need to consider whether knowing that will harm the child, whether they need to know it, um, or, or what would the impact of it be on their relationship with their father, the relationship with you, or how they think about themselves. So I think that's really difficult to share the details, and that we don't always need to share all details with children, that they can be filtered in a way where we can still be honest, but they can still maintain, if they had a healthy relationship with their father, um, a healthy one, or mother. Okay, so that's all we have time for this evening. I want to say shukran to everyone who's taken this time out on a Sunday night. And inshallah, if you are currently helping your child with trauma or has experienced trauma, if you yourself have experienced trauma, inshallah, I wish you all the best on your journey. It's a process that needs the time it needs. It cannot always be rushed. And I ask that you, as caregivers, just be kind to yourself and don't judge yourself too harshly. How one parent responds might not be how you respond, but alhamdulillah, you're doing the best you can. And the very fact that you're here means that you care and you want to be more available and aware. And so, alhamdulillah, your child is benefiting from your presence, even if it doesn't necessarily translate into action immediately. So shukran to everyone, and assalamu alaikum.